This is the hearing loss and dementia study that we've all been waiting for. Hey guys, Cliff Olson, Doctor of Audiology and founder of Applied Hearing Solutions in Phoenix, Arizona, and in this video, I'm reviewing some groundbreaking research that shows us the strongest link that we have ever seen between hearing loss and dementia. Okay, so here's the thing. The research looking at the link between hearing loss and dementia has been out there for a while now. In 1989, a study titled Relationship of Hearing Impairment to Dementia and Cognitive Dysfunction in Older Adults, researchers identified that hearing impairment was more prevalent in demented than non-demented patients, and that the risk of dementia increased with progressively greater amounts of hearing loss. In 2011, a study by Dr. Frank Lin out of the Johns Hopkins School of Medicine identified that individuals with a mild hearing loss were 2 times more likely to get dementia, moderate hearing loss was 3 times more likely, and severe hearing losses were 5 times more likely to get dementia. In 2020, the Lancet Commission identified that hearing loss in midlife was the leading potentially modifiable risk factor for dementia later in life at 8%. In 2023, the Achieve study identified that individuals who were at higher risk of developing dementia decreased their risk with hearing aid intervention. And in 2024, the Enhance study identified that individuals who had treated hearing loss showed cognitive stability, while individuals without hearing treatment declined in working memory, visual attention, and psychomotor function. And this is only a handful of studies over the course of this time linking hearing loss to dementia and cognitive decline. At this point, if all of this correlation data from multiple sources doesn't have at least your attention yet, it should, especially since we just had another new study come out that gives us even more clarity about how hearing loss affects your brain and cognitive function, what role genetics play, and how hearing aids impact it all. But before I break down this incredibly detailed study, making it easy for you to understand, do me a huge favor and click the like button. Really helps out the channel. And if you are not yet subscribed to the channel with notifications turned on, go ahead and do that as well. It's greatly appreciated. And let me know down in the comments section if you believe that this link between hearing loss and dementia is legit, or if you think that it's just a conspiracy so hearing aid clinics can sell more hearing aids. Alright, so in November of 2025, a new study was published in the Journal of the American Medical Association titled Hearing Loss, Brain Structure, Cognition, and Dementia Risk in the Framingham Heart Study. The Framingham Heart Study was originally started to track factors causing cardiovascular disease and stroke in residents of Framingham, Massachusetts in 1948. But over the years, the study has been expanded to include genetic research, sleep apnea, diet, and cognition. In this particular study, they were able to track over 2,000 individuals who had a formal hearing test. About 1,600 of them completed detailed cognitive testing. Around 1,500 of them had brain MRI scans, and just over 900 participants aged 60 and older were followed for nearly 15 years to track dementia outcomes. These participants were seen at multiple intervals over the course of this 15-year time period for scanning and testing. However, the dementia outcomes were evaluated much more frequently over the course of this 15-year window, making these estimates significantly more reliable than just an outcome measure done at the very end of this 15-year window. Alright, let's talk about how they evaluated these participants, starting with hearing loss. Hearing testing was performed by licensed audiologists using pure tone audiometry inside of a sound-treated booth. The researchers broke down the hearing loss categories using pure tone averages of these participants' better hearing ear, averaging the hearing loss at 500, 1,000, 2,000, and 4,000 Hz frequencies. Normal hearing is considered a pure tone average between 0 and 16 dBHL. Light hearing loss was between 16 and 26 dBHL. Mild hearing loss was between 26 and 40 dBHL. And moderate or greater hearing loss was greater than 40 dBHL. It's interesting that they even included a slight hearing loss category here, but the reason for that will become abundantly clear here in a few minutes. For MRI testing, individuals underwent multiple MRIs at key exam time points. They measured total brain volume, which is the size of the brain, hippocampal volume, which is the memory part of the brain, and white matter hypertensities, which are lesions in the white matter of the brain often associated with vascular brain injury. Cognition was measured by testing multiple cognitive domains instead of just one. These tests were for memory, both verbal and visual, executive function, reasoning, and visual spatial skills. The researchers combined these different tests into a global cognition score that they were able to track over time. Dementia was tracked by ongoing surveillance from a neurologist and neuropsychologist who evaluated participants' cognitive testing, medical records, imaging, and family interviews. This led to a consensus diagnosis of whether or not a participant actually developed dementia or not. Now, the timeline in which these evaluations were performed was a huge strength of this study. Hearing was tested first, in midlife for most of these individuals, which is typically earlier than most people get tested. Brain scans and cognitive testing were completed at key points during the study, and dementia was tracked for up to 15 years, which makes reverse causation less likely. And this also gave researchers the ability to track changes over time. The researchers even statistically adjusted their results, taking into account age, sex, education, APOE4 genetic risk, blood pressure, diabetes, and smoking status, meaning that they controlled the study to reduce these confounding factors so any associations were not simply explained by these variables, but more likely the hearing loss itself, although it is not entirely possible to control for all of these variables completely in an observational study. Okay, so at this point, hopefully you're still with me and you're interested to learn about what they actually found. First, they identified that individuals with mild or higher levels of hearing loss had smaller brain volume, which is not a good thing considering that smaller brain volume often correlates with impaired brain function. They also identified that individuals with slight hearing loss, which is a pure tone average between 16 decibels and 26 decibels, showed more white brain matter hyperintensities, which is often associated to vascular issues in the brain. Both of these findings were present before dementia developed and suggest that hearing loss could be a sign of accelerated brain aging. While they did measure hippocampal brain volume as well, that was not the strongest MRI signal that they found. The strongest signal was a shrinking in the overall brain volume and the hyperintensities of the white matter. Second, the researchers identified that the strongest association between hearing loss and cognition was not a decline in memory like one would suspect, but rather a decline in executive function. Executive function is how efficiently your brain works. It's not whether you can remember information, it's how good you are at planning, switching between different tasks, staying focused, and your overall processing abilities. On a side note, decreases in executive function have also been strongly linked to decreases in hearing performance and background noise. Third, regarding hearing loss and dementia, the participants in this study, if they had any level of hearing loss, slight or higher, they had a 71% higher risk of developing dementia compared to individuals with normal hearing. In addition, individuals who were genetic carriers for at least one APOE4 allele and hearing loss had a threefold increase in dementia risk, although this subgroup was relatively small. And fourth, researchers identified that individuals with untreated hearing loss had significantly higher dementia risk, and individuals with hearing aids, according to the researchers, had no significant increased risk. Although the hearing aid use was not randomized in this particular study, so we can't technically say that hearing aid use reduced the risk, only that the risk signal was significantly stronger with untreated hearing loss. Alright, so what should our key takeaways be from this study? First and foremost, for the complexity of this study, this might be the most well-designed study that I have ever read, although it's not perfect. The main thing that stood out to me was that this study was completed in a very non-diverse group of individuals. We're talking 100% non-Hispanic white individuals, which means that we can't really take this information and generalize it to the whole population. Of course, if you're a non-Hispanic white male or female, then you should take this study very seriously. This study was also an observational cohort study, not a randomized controlled trial, which means that we can see associations in this data, but we can't get cause and effect. That being said, we were able to see consistent patterns across hearing tests, brain scans, cognition testing, and dementia diagnoses, which are still meaningful. And remember, the negative health effects of tobacco were not identified through randomized controlled trials. They were also largely identified through large observational cohort studies. My second takeaway is that all of these findings were significantly stronger in this study compared to older studies for several reasons. The researchers measured hearing loss before evaluating for dementia, reducing the likelihood of reverse causation bias. They measured objective changes in brain structure at key points during this time period, and even when adjusting for numerous confounding factors, the results still held, showing that this link between hearing loss and dementia isn't just due to people getting older or having other vascular issues. My third takeaway is that even though this study identified a link between hearing loss and structural changes of the brain, they did not look to see if hearing aid use actually had any impact on this. So no conclusions about hearing aid use and altered brain volume or white matter changes could be made from this study. My fourth fourth key takeaway is that once again, we're seeing that individuals who use hearing aids are able to reduce their risk of dementia, whereas individuals who have hearing loss that is untreated see a significant increase in their risk. Now, I want to be very clear here. This does not mean that if you treat your hearing loss with hearing aids that you will not get dementia. And it also does not mean that if you do not treat your hearing loss that you will get dementia. But based on all the research that exists today, it is apparently a very smart idea to treat your hearing loss if you want to potentially reduce your risk of developing dementia later in life, whether that's with hearing aids or cochlear implants. And if you do treat your hearing loss, you want to treat it optimally, which means that you want to make sure that you find a hearing care professional who follows comprehensive audiologic best practices. When using hearing aids, best practices are the only way to ensure that your hearing aids are programmed optimally for full benefit. And the best way to find one of these extremely rare hearing care professionals who follows best practices is to go to my website, hearingup.com, and find a Hearing Up Network member in your area. All Hearing Up members have been vetted and are committed to following comprehensive audiologic best practices to ensure that you can hear your absolute best with your hearing aids. So if you want to get your hearing loss treated by a professional who will not use the fear of dementia as a scare tactic to get you to purchase hearing aids, then finding a Hearing Up Network member in your area is your best bet. And my fifth key takeaway from this study is that it is incredibly concerning to continuously see this link between hearing loss and cognitive decline and dementia with pretty much every research study that's been coming out. At this point, if there was no link, or if there was even just a weak link between hearing loss, cognitive decline, and dementia, there would be numerous studies out there about it. But we're seeing the exact opposite. Every single study that I've seen over the course of the past 15 years has shown a link. And I think it's pretty apparent at this point that hearing loss is not just an ear issue, but it's a brain issue. And it appears as though hearing loss is a very strong early warning signal that something's going on with your brain. I also think that if you have a family history of hearing loss and dementia, or you know that you're a carrier of the APOE4 allele, it is probably even that much more important to get your hearing tested and get your hearing loss treated. Because here's the bottom line. Hearing loss may lead to an increased risk of dementia, but hearing loss is a very modifiable health condition. The earlier you identify your hearing loss and treat your hearing loss, the better, not just from an overall communication standpoint, but it could also reduce your risk of developing dementia later in life.